Dr. Jenny at Pro Chiropractic here again. This morning I want to demonstrate for you guys a technique that we do in the office called Cox Flexion distraction. It was invented by a man named Dr. James Cox, and that's why it's named that. With this technique we're going to do today is I'm going to be having the tables actually going to split open, and it's going to flex forward and it's going to extend back up. And what that is for and why we do this technique in the office is to help with anyone with like a hot low back, disc that may be herniated. And what this technique does is it opens up that spacing in that intradiscal space in there and allows that nerve flow, that spinal compression to open up and take pressure off. So what I'm going to do with this technique is we actually strap our patient's legs in so we can open up and create space in there. And then we have this little handle that we put on our table. And with this, instead of doing a side posture adjustment or instead of doing the table going up and down with a drop piece, I'm actually going to lift your shirt, if that's okay, David, here a little bit. And I'm going to put my hand right on his low back here, right where that L5, L4 space is at. And I'm going to put some pressure in there to help open up while I open up this table. I've already unlocked the table for this video. And while I open up this space in here and help get some pressure released through those low back, those lumbar discs that get compressed very, very frequently. This is super helpful for someone that has disc compression that may be going, causing nerve pain that goes down to the leg, sciatic pain, and helping to relieve that pressure in there. Now I can turn the patient from side to side, and you can see that lateral flexion that can happen in there. If the patient has a disc that herniates out to, say, a certain side, I'm going to open that up the way I need to in order for that disc to kind of suck the best, what's called nucleus pulposus, back into that disc so it's not affecting that nerve right in that low back. So this is something that I do with my patients that have disc herniations. They love it because it's not high impact. It helps open that space up nice and easy. And we just go through there just a couple minutes to help create space in there and help take any pressure and tension off of there. It also opens up the spinal canal about 28% and really just does amazing, amazing work with disc herniations in helping relieve pressure in the low back. So if it's something that you're interested in, if you're suffering from a low back injury, a sprain, strain, or if you're suffering from disc herniation causing radiation down into your leg, into your foot, this would be great for you in our office. If you have any questions, my name is Dr. Jenny at Pro Chiropractic. We're happy to help and here to serve.